Hello and welcome to the topic of ABCs of cardiopulmonary resuscitation or CPR. By the end of this session, you should be able to define the acronym CPR, summarize the purpose and benefits of CPR, discuss the preparatory steps before CPR is performed, and explain the steps of CPR. Let's get started. So, what is CPR? CPR consists of the use of chest compressions and artificial ventilation to maintain circulatory flow and oxygenation during cardiac arrest, which is when one is unconscious and is found to be pulseless. We will be looking at the process flow to CPR, beginning with understanding the pre, during, and what is done after CPR. Before you begin the CPR, you begin with first assessing the danger and the safety to rescuer. Ensure that one is wearing their personal protective equipment, which consists of mask, apron, and gloves. Next, check for responsiveness by tapping both the shoulders of the patient twice and calling, "Hello, hello, are you okay?" Follow this by shouting or calling for help, which is seeking for emergency help and requesting for the resuscitation trolley and defibrillator. Lastly, ensure that the patient is positioned at a supine position, and if the face is facing downwards, roll them over to the supine position. Now, during CPR, you may want to consider these three important points. First is airway. A for airway assessment. Open the airway using the head tilt chin lift maneuver. B for breathing assessment. Look at the chest, neck, and face for not more than 10 seconds. So, cardiac arrest is present when there is an absence of breathing or presence of abnormal breathing or agonal breathing. Immediately begin your CPR in the absence of normal breathing. C stands for circulation assessment. Pulse check is not recommended prior to initiation of the first chest compression. Let's look at them individually. So, airway is opened using head tilt chin lift maneuver. This is to allow the airway to be patent. Now, how is it done? Tilt the patient's head back by pushing down on the forehead. Place the tips of your index and middle fingers under the chin and pull up on the mandible and not on the soft tissues. This lifts the tongue away from the posterior pharynx and improves airway patency. Be sure to pull up only the bony parts of the mandible. Pressure to the soft tissues of the neck may obstruct the airway. Next is B for breathing assessment. Look at the chest, neck, and face for not more than 10 seconds. Cardiac arrest is confirmed by the absence of breathing or presence of abnormal breathing. So you begin CPR in the absence of normal breathing. Begin your chest compressions in the absence of normal breathing, and this image shows you how to position your hands as you are performing your chest compressions. C is for circulation assessment. So pulse check is not recommended prior to initiation of first chest compression in a patient who is found to have abnormal or agonal breathing. The technique of chest compressions is very important because this reflects the quality of the chest compressions. Remember to push hard and fast. The rate of your chest compressions should be in sync with staying alive beat. Allow complete recoil after each chest compression. Rescue breaths via bag valve mask ventilation is given at a ratio of 30 compressions to 2 rescue breaths. As for ventilation, 2 ventilations are given via the bag valve mask for every 30 chest compressions. Ensure a tight seal between the mask and the patient's face. Squeeze the bag with one hand for approximately 1 second, forcing at least 500 ml of air into the patient's lungs. The image on the left shows the equipment in the advanced airway category of airways, and the right diagram shows the step-by-step procedure in endotracheal intubation. We will be going in depth in the endotracheal intubation topic in another module. Now let's look at defibrillation. Defibrillation is a treatment for life-threatening cardiac dysrhythmias, specifically ventricular fibrillation and non-perfusing ventricular tachycardia. A defibrillator delivers a dose of electric current, often called a countershock, to the heart. First, attach the defibrillator as soon as it is available with minimal interruptions to chest compressions. Turn the defibrillator on and select leads 2. Analyze the rhythm to identify if it is a shockable or a non-shockable rhythm. Apply coupling agent or pads to the patient's chest. Select energy level to 200 joule in the case of biphasic defibrillator, which is most likely the case. Apply pedals to the chest, charge the pedals by clicking the charge button, and not to forget the clear chant, which is I clear, you clear, everybody clear. Check monitor again to see if it is still a shockable rhythm before discharging shock. Discharge shock and return the pedals to the machine. Chest compressions should immediately resume after one shock. In the event that CPR brings the return of spontaneous circulation, or known as the term ROSC, ensure a few steps are done and maintained. Firstly, intravenous access is secured with fluids, sedation, and/or inotropes are running smoothly. Ensure the placement of the endotracheal tube with a chest X-ray. The nasogastric tube is then inserted and secured well. Lastly, close blood pressure and cardiac monitoring is recommended. Your role is ensuring a blood gas is done to adjust the ventilation and oxygenation status. How do we reassess the patient during CPR? So after every 5 cycles or 2 minutes of CPR, check for normal breathing. If a cardiac monitor is available, the pulse, or which is carotid or femoral, shall be checked when an organized rhythm is seen. When do we stop CPR? This is when the patient recovers with normal breathing, or when the rescuer is actually exhausted, and that is why the rescuers shall be taught to switch the role of chest compressions every 5 cycles or 2 minutes to avoid fatigue. Finally, the take-home messages are: cardiac arrest shall be recognized by unresponsiveness and absence of normal breathing, so chest compressions should begin immediately. High quality and uninterrupted chest compressions shall be emphasized. Chest compressions shall resume immediately after delivery of the first shock from a defibrillator. So we have come to the end of this topic. Please find the attached link below to the Advanced Cardiac Life Support Guidelines for further reference. Thank you.